Hi, in this video we are going to talk about bronchodilators that include leukotriene antagonists and phosphodiestrase inhibitors. Moving toward the asthma, it is a chronic inflammatory disorder characterized by inflammation and bronchoconstriction, which is reversible. Signs and symptoms include cough, chest pain, wheezing, and chest tightness. This is due to the consequence of the bronchoconstriction. There are four types of asthma: atopic, intrinsic, non-atopic, that is caused by viruses or bacteria, aspirin-induced, and exercise-induced. Atopic can be caused by certain pollen or allergens, which include pollen, dander, animal mite, molds. So they can stuck in the respiratory epithelium that is picked up by the dendritic cell, which are antigen presenting cells. These present towards the nearby lymph nodes towards the naive T helper cell with the co-stimulation from CD28 and B7. These T helper cells will differentiate into T helper 2, 1 and 17. 1 and 17 causes the inflammation and influx of the neutrophils that lead to inflammation, while the T helper 2 cells also release interleukin 4, interleukin 5 that causes interleukin 4 causes the B cell to undergo antibody class switching, lead to production of plasma cells that releases IgE antibodies. Now these IgE antibodies coat the mast cell surface and mast cells are now sensitized. Whenever the person is again second time exposed to the allergen, these allergens bind towards the IgE antibodies, lead to cross-linking, causes degranulation of the mast cell, release of that causes release of histamine. So histamine is a potent vasodilator as well as that increase permeability. They bind to H1 receptor over bronchial smooth muscle, lead to bronchoconstriction. Interleukin 5 on the other hand causes the eosinophil activation, chemotaxis and release of cytokines that induce inflammation. A bit of a bronchial smooth muscle physiology we have discussed in the previous video. In this video, we are going to focus over the leukotrienes, what they does towards the bronchial smooth muscle. They basically acts on leukotriene receptors, lead to smooth muscle construction, lead to bronchoconstriction. Now, the drugs classification for the asthma, we have discussed that these are classified into bronchodilators and anti-inflammatory. In this video, we're going to focus over the leukotriene antagonists and the phosphodiestrase inhibitors. So, a bit of physiology, how the arachidonic acid or the membrane phospholipid, when there is a cell injury that causes the release of or activation of a phospholipase A2 enzyme, phospholipase C and phospholipase D that converts the membrane phospholipid into arachidonic acid. Now the arachidonic acid undergoes two pathways, lipoxygenase pathway and the cyclooxygenase pathway. Cyclooxygenase pathway is metabolized by the COX-1, COX-2 or cyclooxygenase enzyme 1 and 2 that lead to production of prostaglandins and thromboxane A2. Prostaglandins, which include PGD2, E2, I, and I2, that causes the vasodilation, increase vascular permeability, and lead to increase in the fever or body temperature. Thromboxane A2 lead to platelet activation by acting on the thromboxane receptors, lead to platelet activation, aggregation, and platelet plug formation. While on the other hand, lipoxygenase pathway is metabolized by the 5-LOX enzyme that lead to production of leukotrienes, which include B4, C4, D4, E4. These acts over their receptors, which are present on the smooth muscles as well as other parts of the body that lead to smooth muscle contraction, increased mucus production, increased vascular permeability, lead to chemotaxis. So they cause inflammation as well as the bronchoconstriction. So the pharmacological agents that basically inhibits the we wanna make or decrease the leukotriene that causes these symptoms. We're gonna give the leukotriene synthesis inhibitors that inhibit the 5-LOX enzyme that lead to decreased production of these leukotrienes, or we can give the leukotriene receptor antagonists that inhibit the receptors competitively, lead to decreased action of leukotrienes over their receptors. Now we're gonna talk about the aspirin-induced asthma, because when we give aspirin, aspirin inhibits the cyclooxygenase COX-1 and COX-2. Now that this pathway is inhibited, but the arachidonic acid will undergo lipoxygenase pathway, which is still viable. And this leads to overproduction of leukotrienes, which exaggerate the symptoms of asthma due to these leukotriene production. So leukotriene, basically receptor antagonists, these are divided into two. As we have discussed, they are receptor antagonists and as well as leukotriene synthesis inhibitors. In the leukotriene receptor antagonists, they bind to leukotriene receptors competitively and blocks them. They include Montelukast, Zafirlukast. These are per oral medications. These are indicated into asthma prophylaxis as well as exercise induced and aspirin induced. So side effects are non-specific. These include headache and rash. While the leukotriene synthesis inhibitors inhibit the 5-LOX enzyme, this leads to decreased production of leukotrienes, and these include cytokine with the side effects of hepatotoxicity. Moving toward phosphodiesterase inhibitors, these inhibit phosphodiesterase enzyme, which normally converts cyclic AMP into AMP. Now, we have discussed that the sympathetic nervous system causes activation of beta-2 receptors that causes increase in the cyclic AMP level. When the cyclic AMP level are increased, that causes dephosphorylation most myosin light chain kinase that lead to smooth muscle relaxation, lead to bronchodilation. If we want to bronchodilate, we're gonna increase the cyclic AMP level. This can be increased by inhibiting the phosphodiesterase enzyme that lead to increased cyclic AMP, lead to smooth muscle in the bronchi, and also blood vessels to cause bronchodilation as well as vasodilation. So the class of medication include theophylline, which include methylxanthine, which is per oral medication, indication for the COPD and hypertension because they causes the blood acts over blood vessel that lead to vasodilation and decreased heart rate. They are also indicated in the hypertension. Side effects due to there is narrow therapeutic index. They are easy to overdose. Small amount or small increase in the medication level can cause the toxicity, and the toxic symptoms are insomnia, nausea, vomiting, seizures due to toxicity in the CNS, and toxicity to the CVS causes arrhythmias. They are metabolized by cytochrome P450 enzymes. So whatever the medication that we are going to give, if they induce the cytochrome P450 enzyme, they causes the increased metabolism of methylxanthine that lead to decreased action of methylxanthine. If we give the pharmacological agents that inhibit the cytochrome P450 enzyme, that lead to increase in the plasma half-life of the methylxanthine that lead to toxicity. They are due to their toxic symptoms, they are rarely used nowadays. Now we want to make a simple and a fun mnemonic to help you efficiently memorize all these pharmacologic facts. So for the leukotriene modifying agents, let's use a white train. Now the train stop represent the target receptor. So we'll put the leukotriene receptor antagonist here. Since they have leukost in their name, let's put 4-leaf clover for monteleukost and zephyr leukost. Hopefully they'll make our luck last. Now the back of train is under construction. So let's use it to represent leukotriene synthesis inhibitors. This will be an army lieutenant named Z for Xylutin, and he's holding a big rotting liver to represent hepatotoxicity. Let's have a track and a field athlete, which represents exercise-induced asthma and aspirin-induced asthma, which is he's trying to jump over the train with a giant springs on his shoes, which represents aspirin-induced asthma. This will help you remember leukotriene modifying agent basically are effective against both. Now methylxanthine will be represented by a big mug of coffee. Bathing inside a coffee mug is a main drug of this group, theophylline, which is represented by Socrates, the father of Western philosophy. Since theophylline is effective in treating COPD, let's put an angry police officer next to the mug who is about to arrest him for public indecency. There are measurement lines max out 15 on the side of the coffee mug to represent low therapeutic window. But the mug is way overfilled. All this coffee is too much for the Socrates to handle, so he is vomiting out of the cup. A human heart and the brain is also floating inside to help you remember the cardio and the neurotoxicity. Finally, a chrome-colored cell is climbing over the side of the mug, trying to get a sip of coffee because methylxanthines are metabolized by cytochrome P450. So thank you for watching. We'll see you next video. Like, share, and subscribe.